The next oncologic emergency is acute tumor lysis syndrome. Usually, it occurs 6 to 72 hours after initiation of chemotherapy or radiation treatment. Tumor lysis syndrome, it's due to rapid release of all cell content into bloodstream. Most common tumor cause tumor lysis syndrome, including leukemia, lymphoma, small cell cancer, and metastatic adenocarcinoma. Acute tumor lysis syndrome etiology factors, including large tumor burden, high growth fraction, high pre-treatment serum LDH or uric acid, pre-existing renal insufficiency or acute renal failure. It's really important for us as a physician and as health providers to remember that acute tumor lysis syndrome, it's associated with some electrolyte abnormalities. For this reason, I put this slide just to know which electrolyte disturbance will happen with tumor lysis syndrome. If you look to this abnormality finding sodium, potassium, and calcium, and phosphorus, and uric acid, most of the time with tumor lysis syndrome, you'll find potassium is high, you'll find uric acid is high, and you'll find phosphorus is high. Main life-threatening problems, as we know, acute tumor lysis syndrome, it's life-threatening problems. And this is secondary to hyperkalemia, hyperuricemia, hyperphosphatemia, and hypocalcemia. It could result in acute renal failure and arrhythmias. Treatment, first of all, stop chemotherapy or radiation, aggressive intravenous hydration and diuretics. Make sure that the urine is alkaline and keep pH around 7. You can give bicarb, and also you can give insulin K-oxalate for hyperkalemia. Emergency hemodialysis for some patients if their potassium is more than 6, if their urate is more than 10, if their creatinine is more than 10, or if you are unable to tolerate, or if the patient unable to tolerate diuretics. Also, in some centers, if they think there is some risk for tumor lysis syndrome, sometimes they start them in allopurinol as a prevention strategy or a prevention tools.